Hello and welcome to the OT Meeting Room. I'm your host, Deborah Battistella. In today's talk, I'm going to share with you information about translating knowledge to practice. The reason for this is because evidence-based interventions tend to take a long time to enter clinical practice. We know this to be true for stroke recovery. So when I think about interventions like mirror therapy and action observation and mental practice or mental imagery and modified constraint induced therapy programs, they're not commonly seen, especially in subacute rehab settings. So if you understand how to translate knowledge to practice and I give you some guided actions to follow, that might change things for you. So the goal for bringing awareness to a specific model, knowledge translation model, I intend to help clinicians move from intervention ruts into using evidence-based interventions in their practice on a regular basis. And I hope to help improve clinical outcomes for stroke survivors and their loved ones. So this is my definition of knowledge application. I see it as the ability to apply research information appropriately to positively impact client recovery and improve clinical outcomes. Knowledge translation is a systematic process for integrating knowledge into action. I think we all can agree that it's one thing to know about something that we learn from the evidence and completely a different thing to apply it. So applying knowledge is the challenge. Research shows that it's a challenge and it requires a level of thinking. It requires some changes to be made in the way that we navigate our day. And it requires clinical reasoning. It requires a lot of energy. And so if you have struggled in your ability to apply knowledge, please don't think that you're alone because you are not. So, like I said before, there is a breakdown in our systems because we don't see current evidence often applied in clinical situations. And education is one way that we can help move that needle forward. So, I'm going to speak specifically about the knowledge translation for disability and rehabilitation research, the KTDRR method. This is an evidence based method that closely aligns with occupational therapy process and it can guide our thinking. It's a structured process, it's a structured way for integrating information that we learn in whether we're doing the research or if we go to a continuing education course so that we can bring the knowledge back to our clinics and share it with our patients, our clients, so that they have better outcomes. We're going to go to the KTDRR website in a moment, but this cool model, I want to say before we go to the website, is it's a structured process, like I said before. And the cool thing about having a structure to follow is it it gives us like fill in the blank spaces where we can actually decide where information should go, but it also can it gives us a strategy. It gives us a way to move forward. When we look at the big picture of everything that needs to happen in order to implement a new intervention, it oftentimes is overwhelming for us as clinicians. And especially if you work for a larger system that wants a process in place, this provides a structure for you to have that process in place. The other thing is a lot of times we're dealing with clinic culture, we're dealing with people who feel as if they may be too busy to implement something new, or maybe people get nervous and they're kind of afraid to implement something new, but they're also embarrassed to say something. This can take all of the emotions out of things and make it a little bit easier to move forward. So let's go to the website now. And this is what it looks like. It's the Center on Knowledge Translation for Disability and Rehabilitation Research. I love this site. Their goal, they say, is to help disability researchers increase their understanding of knowledge translation. So, why is it important? It's important because when we actually apply the research that the evidence shows works, we are actually going to improve the lives of people who have disabilities. So, this is the model here. It's the knowledge to action model. And I love this. So, if you see in the center of this model, is that's where knowledge creation occurs. So, we have knowledge inquiry, we synthesize our knowledge, and then we have some tools and products that can be used. So it's tailoring our knowledge to the clinics that we work in, to the clients we serve. So if you look on the outside of that circle, you can see that there is an action cycle. And if you start at the bottom, the very bottom, you'll see that we're going to identify the problem. So we'll identify a problem and then we determine the no-do gap. Once we have that, then we can identify, review, and select the knowledge that we want to apply. Going in a clockwise fashion, the next box tells us that we need to adapt knowledge to the local context. So we are going to think about the setting that we work in and decide how that knowledge would be useful and how do we need to adapt it? How do we want to adapt or modify anything to make it feasible to use? And then moving forward to the next box, we are going to assess barriers and facilitators to knowledge use. That's very much occupational therapy, right? So looking at anything that's getting in the way, and then what is something or what are the things that will actually make it possible for us to use these interventions? Then moving to the next box, we're going to select, tailor, and implement interventions. And I'm pretty sure you know what to do with that information. Then, as the information is being used, as we're using those interventions, we're going to monitor knowledge use. We're going to self reflect. We maybe meet as a team and talk about how the interventions are going as each individuals, or if you're doing more of a group process, talk about that and make any adjustments that need to be made. One thing I want to say about the application piece where you're actually using the intervention, um, it's probably not going to be pretty the first time you do it. It may be clunky, but that's part of the process. That is part of the learning process because the more we do something with, that repeat use, repetition is not just for clients recovering from a stroke or other type of injury. It's for us too along the learning process. So we're going to monitor our use, our knowledge around that use, make any adjustments that need to be made. We're going to evaluate outcomes, so client outcomes, clinic outcomes, and then we're going to discover ways that we can sustain that knowledge use. A lot of times if we make it a habit or it becomes a regular part of our clinical practice, it becomes more habitual. And that is one way that we can sustain that knowledge and continue to use it. So this is a quick overview of the model. I will put the website link in the notes below. And I hope that you do go to this model and take a peek at that and see how that might work for your practice. Now I want to go back to the presentation. And so now that we've reviewed that, I know that I gave examples for the different boxes that I talked about there, but I do think there could be some possible next steps to be taken. And I think it's always important to look at our current reality and think about an intervention that we've been wanting to use. We're not currently using it, or maybe we use it less often than desired. And then look at that circle in the center, the center of the cycle, the triangular type shape there, and determine where you are. Consider your understanding of the intervention, identify the amount of clinical use, and then once you have your current reality based on that model, you want to think about your future reality. What do you want to create? What is your vision for using the intervention? Do you have a desire to use evidence in practice? Um, do you need to use evidence in practice? Is, perhaps management is encouraging it. Perhaps your colleagues and peers are encouraging it. Well, whatever. Why do you want to use a new intervention? Is it to improve clinical outcomes? Is it to maintain currency and be current as a clinic in general, as a clinician? Um, how how is that important and why? And then when is it appropriate to be used? You want to think about the diagnosis or diagnoses that people have. Who is your client population? Thinking about those types of things. And then apply the model. And through that process, I want you to understand that I think it's really important to accept that translating knowledge to practice is a process. And like I said earlier, it can be clunky, it can feel challenging, it can feel difficult, but a lot of times learning does. Perhaps you can put an integration team together. If you are an individual practice owner, perhaps you have a state association that you would like to connect with. Perhaps you have local colleagues that you want to connect with. You can always reach out to me at Deborah Battistella OT at creativeconceptsot.com. I love working on teams, helping people to build new programs or get something going. Determine where you are within that model. Know that you're going to change places within that model as time goes on. Use the action process to ensure that you create a thorough process. I think sometimes, when we get an idea, we think, oh, it's going to be so easy and we'll just do this. Then as you start moving forward with it, you can see there are a lot of pieces and parts that need to be integrated. This model helps to make sure that it's a thorough process. And then start using the intervention. So that is my presentation. That's where we're at. Yeah. Hi. That is what I have to talk about today. I hope this makes sense to you. I really think that if we have a level of structure, if we have a way of moving forward with things, with a process, that we can feel good about the way that we practice in our clinical areas. So, yes, I am wearing a sweatshirt today, a hoodie. It is chilly here where I live. And yeah, thank you for watching and make it a great day.